Now, Midday Medical with Debbie McFadden. Sponsored by University of Iowa Healthcare.
During winter, the risk of accidents increases due to conditions like slippery surfaces, frigid cold, or participating in fun activities like sledding. That's why access to urgent care is so very important. Here to talk about this today is Caitlin Carr with University of Iowa Healthcare. Let's talk about the typical type of injuries you see this time of year.
So as you mentioned, the most common injuries that we're seeing this type of year oftentimes are weather related. We see a lot of people who stop into our clinics following a fall on the ice or maybe a low speed motor vehicle collision. Sports are year round, so we're still seeing a lot of athletic injuries, and then workplace injuries continue as well.
Well, could you help us, maybe give us some advice on how to distinguish between a strain, a sprain, a fracture? I know pain level is going to vary,
Yep.
But yeah, give us some advice on that.
You know, I always tell our patients, first and foremost, if you have a concern or a question, don't hesitate to come see us. I think the biggest thing when you're thinking about a sprain versus a fracture or those different musculoskeletal injuries would be, how has this affected daily life? If you've had an injury to your ankle and you can't stand on it or bear weight, you've injured your hand, you can't do those normal activities, or there's a really obvious deformity, come see us.
Yeah, as far as is there a type of accident or fall where you definitely have to get medical attention right away as opposed to waiting it out?
Yeah, I think anytime there's a deformity where you have a break in the skin, so let's say that you've fallen and you have a cut or a laceration, good opportunity to come in. I have a really low threshold to tell people to be seen if they've fallen and hit their head. And then any motor vehicle collision, you've gotten in a fender bender and you're experiencing pain, that's a good opportunity for us to see you.
And you know, it's winter time, cold and flu season. That's also typical of this time of year, so that kind of falls under the seasonal issues.
Correct, yep, and we are, you know, access to a walk-in setting is a great opportunity to kind of take some of that pressure off of our local ERs, get into a setting where we can see you same day for those very common cold, flu, RSV, strep, all those things we're seeing right now.
Well, University of Iowa Healthcare has 2 urgent care locations in the Quad Cities. You're on that East 53rd corridor by Costco, I like to say,
Yep.
and off of Lincoln Road in Bettendorf. Thanks for coming in today, Caitlin, to talk about this important stuff. I'm Debbie McFadden for Midday Medical.